Hello, and welcome to Passing Medications, ASCP's Medication Administration video series. In the next 15 minutes, we will observe a video presentation detailing the procedure for administering medications by way of a feeding tube called the gastrostomy tube, or G-tube. We will address flushing guidelines and fluid overload precautions, and ways to deal with some potential G-tube complications. A G-tube is a tube that is placed directly into the stomach by a small surgical opening through the abdominal wall. A person experiencing impaired swallowing and a need for long-term nutritional support will have the option of G-tube placement. There are numerous diagnoses that can preclude the election of a G-tube placement, but regardless of the reason, the procedure for medication administration by way of a G-tube is the same. As with all medication delivery procedures, we start with the basics. The 5 rights of medication administration: right person, right medication, right dose, right time, and right route. There are multiple steps to proper administration. Some organizations may choose to emphasize 6, 7, or more rights of administration instead of 5. For simplicity's sake, this video will stress the 5 basic rights, while covering other important aspects of medication administration, such as administering the right dosage form, giving the medication for the right reason, conducting the right assessment, and performing the documentation in the MAR. Prior to the administration of any medication through the G-tube, the nurse must be certain the order specifically states the G-tube as the right route. If the doctor's order does not specify a route, a clarification will be needed. Once certain the G-tube is the ordered route, our nurse can remember the sequence of administering medications by way of a G-tube with the acronym POPCORN. Prepare the resident and setting by obtaining medication parameters, assessing for pain, and gathering supplies needed for the procedure. Observe hand hygiene practices by washing hands. Perform the 5 right triple check system while preparing each medication. Check for positive gastric placement according to facility policy. Organize to ensure enough water is available to flush before, between, and after each medication while maintaining fluid restrictions if ordered. Rinse the syringe and store according to facility policy. And note all medications administered in the medication administration record. Watch as the nurse prepares Mr. Hansen for the procedure. If the resident is receiving enteral feeding around the clock, or just prior to the med pass, and one or more of the medications is incompatible with enteral feeding, or needs to be administered on an empty stomach, remember to pause or turn off the enteral feeding pump 1 to 2 hours prior to medication administration. Use a reference to look up enteral feeding interactions or incompatibilities prior to administering any new medication via the G-tube. Phenytoin or Dilantin suspension is an example of a medication that is incompatible with enteral feedings. The absorption of phenytoin is greatly reduced when the two are administered together. If it is impossible to administer incompatible medications at a time when the feeding is not running, monitor for adverse effects, such as seizure activity, and document such monitoring in the resident's record.
Hi, Jerry.
Good morning.
Can you please verify your last name for me?
Hansen.
Thank you. Jerry, I'm going to be preparing your medications this morning. Do you think you may need anything for pain?
I don't think so, thank you.
Okay. I'm going to go ahead and get everything ready now.
Okay.
The nurse completes the preparation of the setting by ensuring Mr. Hansen's head of the bed is elevated at least 30 degrees. The nurse measures a total of 200 cc's or milliliters of water to dilute medications and flush Mr. Hansen's tube, and places it at the bedside along with the linen saver. Take note that the nurse observes hand hygiene practices by washing hands prior to returning to the medication cart to prepare medications. Performing the 5 right triple check system for each medication prepared, Our nurse ensures the right medication and dose is prepared at the right time for the right person, and the G-tube is the correct route. The small liquid dose of furosemide is measured by using a calibrated dropper, then placed in its own medication cup. Tablets are crushed into a fine powder. The nurse should be familiar with and have access to a list identifying medications that should not be crushed to avoid any unwanted medication effects. Enteric-coated, sustained released, and sublingual tablets cannot be crushed. If the handling of any medication is expected, such as the opening of a capsule, it is a good practice to wear gloves. Doing so helps to prevent absorption of medication through the skin while ensuring medication integrity. Again, always refer to a do not crush list before opening any capsules. Some medications, such as proton pump inhibitors used for upset stomach or gastroesophageal reflux disease, commonly referred to as GERD, have specific preparation procedures if the medication is going to be administered via a G-tube. Be sure to check the package insert or other authoritative reference before administering any new medication via a feeding tube. If the dosage form precludes the medication from being crushed or opened easily, contact the prescriber for an alternative order, and ask your pharmacist if you have any questions. Note that the nurse is placing each medication in a separate cup. She will use the pre-measured water at the bedside to dilute the medication prior to administering through the G-tube. It is recommended that all medications, even liquid forms, be administered with dilution. The nurse places gloves, an alcohol pad, and all individually prepared medications on a disposable barrier. She then closes the medication administration record book, ensuring the privacy of all information contained within, and locks the medication cart. After cleansing the hands with an approved hand sanitizer, she is now ready to approach the resident. The door is closed to ensure a private setting.
Hi, Jerry. I'm back with your medications. Do you have any questions before we begin?
Nope, everything's okay.
Okay, I'm going to make sure your tube is in place.
Maintaining infection control practices. The nurse puts on gloves. The nurse exposes only the area of the body required for this procedure and protects Mr. Hansen's linen and clothing by placing a linen saver just under his tube site. The nurse checks for positive gastric placement according to her facility policy, usually by auscultation to verify a gurgle sound followed by a residual check. Each medication is diluted and dissolved by using the pre-measured water. The nurse starts the procedure with a 30 cc warm water flush, then follows with a medication while pinching the tube between each flush and medication to prevent excess air. Our nurse is demonstrating a 5 to 10 cc warm water flush between each medication to keep the G-tube patent and reduce the risk of potential medication interactions. As an alternative to flushing between each medication, some facilities' policies and procedures require flushing only before and after the group of medications due at the time. This is an acceptable practice as long as there are no known incompatibilities between medications administered concurrently. If incompatibilities exist, flushing between medications is required. So be sure to follow your facility's policies and procedures for flushing. She organized the flush amounts to ensure at least 30 cc's of water remained for the final flush. Remember, fluid overload can be a concern for some residents. For example, persons with congestive heart failure and renal failure may be on fluid restrictions, and an overload of fluids can result in a quick decline in health. It is crucial that the nurse note and adhere to any resident-specific fluid parameters when administering medications by way of the G-tube. The nurse will be sure to monitor Mr. Hansen's tolerance throughout the medication administration procedure. After the final water flush, the nurse clamps the tube or, if ordered, attaches the feeding. The syringe and barrel are rinsed, and the parts are left separated to dry. All disposable cups, barrier, and gloves are discarded, and before exiting the room, the nurse washes her hands. The procedure is completed when all medications administered are noted in the medication administration record. We have just observed our nurse perform the procedure for administering medications by way of the G-tube. Now let's talk about a few potential G-tube complications you may experience. Number 1, the clogged G-tube. First, check for the obvious, such as a kink in the tubing. The nurse may try to release a clog by gently milking the tube, followed with a flush of warm water. If there is no kink and milking the tube does not release the clog, follow your facility policy for clogged G-tubes. Never attempt to release a clog by using anything rigid or attempting a forced flush. Another complication is emesis or vomiting. If emesis occurs, stop the enteral feeding or medication administration immediately and assess for bowel sounds while noting any findings such as a rigid abdomen or reports of pain. Keep the head of the bed up. Notify the physician of the emesis and your assessment findings and implement any new orders received immediately. And a potentially life-threatening complication, aspiration, which is inhalation of fluid into the lungs, either enteral feeding, secretions, or emesis. Symptoms of aspiration may include coughing, sweating, shortness of breath, or a blue tint to the skin. If your resident exhibits any of these symptoms, the tube feeding must be stopped immediately and the head of the bed elevated. Oxygen therapy may be ordered by the physician until emergency help arrives. Some other key points relating to G-tubes. Report residuals greater than 100 cc's to the physician after stopping the feeding. Return all residual back into the stomach. Cold water used for flushes can cause abdominal cramping, especially in the elderly population. Always use warm water. Never force any medication or fluid in the tube. Allow gravity to work. Crimp the tube while flushing to prevent water from flowing in the stomach too quickly. Keep the introduction of fluids at a slow and steady pace. If a resident has a bolus feeding, plan medication administration so that it is not at the same time as the feeding. Fluids of more than 400 cc's at one time can result in overload for any adult. Keep the skin around the G-tube clean and dry and cleanse daily as ordered by the physician. If the resident is NPO, meaning they're not taking anything by mouth, provide frequent oral care. The head of the bed should remain elevated at least 30 degrees for at least 1/2 hour after medication administration or feeding by way of the G-tube. And if the resident exhibits any sign of discomfort during medication administration, stop the procedure and assess further. We have reviewed the procedure for administering medications by way of a G-tube and presented some potential G-tube related complications. Now let's review the information with a few situational questions. True or false? It is best for the nurse to prepare the resident prior to arriving in the room with medications. The answer is true. It is much more efficient to assess for pain and obtain any needed medication parameters prior to preparing routine medications than discovering later that an as-needed pain medication is requested or a blood pressure tablet should be held. Mr. Hansen's G-tube is clogged. What is the best action? A. Attempt to force water into the tube with a piston syringe. Or B. Check for any obvious kinks and milk the tube. The correct answer is B. If checking for kinks and milking the tube does not release the clog, follow your facility policy for further action. We hope the last 15 minutes provided a helpful review for the delivery of medications by way of the G-tube. Should you have questions or need clarifications, be sure to ask your presenter. As always, thank you for your time.